One tip I would give new grads like NPs, and probably for the most part any nurse practitioner specialty, is when you're interviewing for a job, be hesitant and appropriately cautious about practices that are owned and operated by either investors or just entrepreneurs who saw a gap in the market. Because from my experience, I can absolutely tell when a practice, whether they're interviewing me or I just have contact with, is owned and operated by clinicians, whether it be therapists, doctors, psychiatrists, and then on the other side are just entrepreneurs and investors who are calling all the shots. It was very obvious in the hospital, working in the hospital as a bedside nurse, that it is profits over people, and I naively thought that outpatient and mental health would be different, but it oftentimes is not. There have been plenty of times, and again, I've worked for practices that are clinician owned, whether that be the owner's a therapist and then there's a medical director, versus when there's just an investor, an entrepreneur who's ooh, this is a profitable market, and it's very obvious. When it's an investor or an entrepreneur, the bottom line is you need to make money. And oftentimes in mental health, what's best for the patient and the providers is not the most profitable. The places I've worked for that were owned and operated by an investor or just, clearly profit motivated, the med check appointments were much shorter. The initial appointments were much shorter. I saw patients, it was patient, had no time to even take time for myself or do what was best for the patient. Because again, what's best for the patient a lot of times isn't the most profitable. So then it comes down to your moral compass, and are you going to do what's right for the patient and then be scolded or reprimanded by your employer, or are you going to not do what's best for the patient but then be in good graces with your employer? And one of the reasons I started working for myself, and not everyone should work for themselves, right? It's good to get experience under your belt, was that I would work for these places and I would realize, wow, there are some scummy people out there who are owning these businesses and they do pretty well until eventually they don't and it all comes crumbling down for the most part. But I was if all these scummy people can do it, I can do it, and then I can make my own practice the way I think patients should be treated and give the care that I need without feeling bad about it.